Hi, I'm Michelle Turner, and I'm here to talk more about your breathing. A lot of my clients have problems, the adults, let's say apnea, asthma, or just general chest function. A lot of the kiddos, especially kiddos that have any issues with vestibular, whether it be cerebral palsy or developmental delays, and anything is obvious from startles as to really jumps or anything like that, the fear of falling, which is one of the things that's really tough in kiddos with developmental delays, because crawling you go up and crawling you go down, and if you don't learn that relationship of going up and down, again, the bracing and the fear of falling becomes much more apparent in the system, let's say, than it would normally do with someone that's working it out. Especially with someone with more complex skills like skiing or snowboarding. I mean, falling is just a fact of life there. So when you're looking at the way, again, you're breathing, and you can have your feet down, up, one. There's no perfect way of breathing. The things to look for, again, are if you're just breathing, are you making noise? A lot of people feel like, if I say expand the chest or expand the belly, now I can do this around me talking and breathing. I have those functions in my system. It doesn't always have to be. So if I usually tell a client to expand the chest, I get the no. You don't need to have vocal cord functions for breathing. You can just breathe in and breathe out. So just lying down, just see how you just breathe. Are you breathing like a little, sort of equated to a frog? Like that. Or, are you just having a very low stomach function? Is there expansion of the chest? Do you feel any movement at all? So because your body should be moving together. I recently had someone that worked in aluminum factory for 25 years. Really horrible breathing, equated to the metals in the lungs, but his capacity of expanding the chest cavity. And now this can happen from too much coughing or asthma or chronic allergies when you're used to doing that. Breast augmentation. Breast is a very violent kind of surgery. You'll find a lot of women with very taut rib cages afterwards. So not only does the taut rib cage not allow the expansion of breath, but it also can cause a lot of anxiety, because where does everything go? You're also going to have a lot more acid reflux, because again, if you burp and it has no place to go, it's going to go up because of the tautness of the chest. Some people's chests are like corsets. They're bricks. I can't even begin. You should be able to move your ribs around, your sternum around. And obviously I do this work, so I'm a bit more organized than the average Joe, but I can go to work on someone, any part of their body, and it's like working on a brick, and you're going, how do they even go down and sleep? So just lying down flat, and again, you can have your feet up or down, I don't care. Just feel how you're breathing. Is the chest cavity moving? And now try and get a bit more severe, what we call a seesaw. And again, a seesaw is not a correct way of breathing. It's a variation. It's a way of me seeing, do you have bone function, muscle function? What's that looking at? And just see how you're breathing and expanding your chest. Does it hurt anywhere? If it hurts someplace, it shouldn't hurt to breathe. If it hurts to breathe, that's one of your basic body functions. Get to a doctor and it really, slow it down. Where does it hurt? Is it right here? Is it here? Is it more in the bronchial? Do you feel it inside your chest? Do you feel that there is fatigue in breathing? That's another thing. You shouldn't get tired to breathe. So, if any of that is apparent. And now, just like in standing, do it on your side. How is breathing in this position? If I'm really stiff like this and I need a pillow and all, I'm laying more like a baby, but most people have to prop up or do these kind of things to even just get the head function. But how is breathing in this position? Can you expand the chest? Can you expand the belly? Can you work on that? And And now if you want to get a bit more complex, as you keep the knees in this position lying down, can I twist? This is where a lot of people have a lot of issues. The lower back or whatever, and again, anything I'm telling you to do, if there's any kind of pain or discomfort, just don't do it. Or can you slow it down in a way to find a way that it just isn't uncomfortable? And now in this position, can you expand the chest? Can you expand the belly? If you're not sure, put your hands here. Feel what it's like to actually expand the chest or expand the belly. Another way too, cough. Feel what it's like for the muscles in the lower belly to expand. And oh, that's what it means. For women, just pretend you're pregnant again. You know, it's just, and can you play with that? And yes, it can get pretty creative. The pelvis can move, the head can move, or it can just be here. You know, and again, you should be able to do these in a twisted position and if anywhere, if let's say in twisted, do you cough in this kind of position because of the way that the lungs are twisted around? Is that more difficult for you? And that's something to maybe look at, to consider with the doctor and to play with. So these are some things to consider. Now, an easy little trick. Now, I can do this with visualization. You might want like a little bag of corn to place it in little places on your chest. And you'll see me do it in some of my videos in breathing. Can you breathe a hand away? Now, again, when I do something like this, I'm not using taut muscles. If you're like this, you know, and your hand's like this, let me tell you, you can't breathe. So that's why I was saying maybe put a baggie there, something with a little bit of weight, or maybe lie your hand here. Can you breathe your hand away? Can you breathe your hand away? Can you breathe your hand away? Can you start working functions of your lungs and your skeletal system, your chest cavity in different ways? And again, the more variations that is, guess what? Can I still breathe? Can I still breathe? Can I, you know, getting in and out of the car, can I still breathe? Well, yeah, because I'm talking, but if I'm going, I love when people get up this way. You're not breathing. So to be able to curl like this and to still do all those things. And again, it just takes practice, it takes variations, it takes to play with it. You know, can you breathe like this? Expand the chest, expand the belly. And again, I'm not asking you to do a whole bunch of funky things. I'm just showing you what's possible. A lot of people just don't know what's even possible anymore. So now after this, I'm going to talk about what to look for when someone does have, let's say, stroke or developmental issues, and where the breathing is really effective. Because this is one of the things that I really pride myself in, that I work on, and people don't. You're not actually seeing the importance of it, but it's so important, just being able to breathe. If you have any questions, just see a professional, whether you see a doctor, and a doctor again, if there's pain, a lot of coughing involved, coughing where it hurts, go see a doctor, go see a professional. If you just feel like, how is she twisting? If just looking at me twisting, and you're going, how does she do that? Then it's time to see a movement professional of how to do all of this. You know, how to do, you should be flexible, you know. I'm 47 years old. I'm nothing, you know, I'm not old, but I'm not young either. And you should be able to just enjoy your body.